right, so the problem says the order is to infuse nitroglycerin 5 micrograms per minute. 50 mgs of nitroglycerin has been added to a 500 ml of normal saline. The nurse needs to calculate the rate in mLs per hour at which to set the pump. All right, so first what I like to do is I like to write out mLs, my medication, conversion, in order. This is optional, but this is what keeps me on track. And then I also like to write out on the side what my answer needs to end in. So my answer needs to end in mLs per hour. So let's fill out what we have. So how many mLs are we working with? We're working with 500 mLs, and then we have 50 mgs of nitroglycerin, and then the order is for 5 micrograms per minute. So our conversion is where we need to see what we need to go to. So our orders in mcgs and our medications is in mg. So we need to go from mg to mcg. And you guys, all this is optional, but it just lets you know what you have, and then it lets you know where you're trying to go. All right, so first we're going to start with the 500 mLs. Because we know that mLs need to be on top, because that's what our answer needs to end in. So 500 mLs per 50 mgs. And this all came from the problem, right? So we know that mgs need to be canceled out, and we know that we need to get to micrograms. So we know that 1 mg equals 1,000 mcgs. So milligrams cancel out, milligrams cancel out. So we know that our answer needs to be in ml. So our mcgs need to cancel out. So our problem says that we have 5 mcgs per minute. All right. So mcgs cancel out, mcgs cancel out. So now we're left with milliliters a minute. But we don't need to be in milliliters a minute. We need to be in milliliters an hour. So we know that 60 minutes is equal to 1 hour. So minutes is going to cancel out, minutes is going to cancel out. We're going to multiply straight across, and we're going to get straight across the top, and we're going to get 150,000. And then we're going to multiply straight across the bottom, and we're going to get 50,000. So then we're going to divide 150 divided by 50,000, and that gives us 3. All right, so what units are we in? We have mLs still left and hours still left. So this is how we get mLs per hour. All right, at 30 mcgs per kg per minute for a patient who weighs 165 pounds, the provided solution contains 100 mgs in 100 mLs of D5W. How would you adjust the infusion control? All right, so your answer is going to end in mLs per hour, okay? So we want to write down what our answer is going to end in, mLs per hour, and then we want to write down our medication, mLs order, weight, and any conversions we need to do. So the medication that we got is 100 mgs, mLs, 100 mLs. The order is for 30 mcgs per kg per minute. The patient's weight is 165 pounds. Now, what conversions do we need to do? So we need to go from pounds to kgs, and from mgs to mcgs. So we know that our answer needs to have milliliters on top. So we're going to start with mLs. So 100 mLs for every 100 milligrams. All right. So then milligrams need to cancel out. So we know that 1 milligram is 1,000 mcgs. All right. So our problem says that we have 30 micrograms per kg a minute. All right. So mcgs cancel out. All right. So now we're going to cancel out our kilograms. So we know that 1 kg is 2.2 pounds. And our patient weighs 165 pounds. And we're just going to put that over 1. So kg cancel out, pounds cancel out, pounds cancel out. And we're left with mLs per minute. But our answer needs to be in mLs per hour. So we know that 60 minutes is equal to 1 hour. So minutes cancel out. And then we want to multiply straight across. And this is what we get on the top. Multiply straight across on the bottom. And then we want to divide the top by the bottom, and we'll get 135 mLs per hour. You guys, I really hope that this video helped made weight-based calculations easier. A patient is receiving lidocaine at 60 mLs per hour. The concentration of lidocaine is 1 gram per 500 mLs of D5W. The nurse needs to calculate the milligrams per minute the patient is receiving. So we want to write out your little chart here. This one is a little different. So we're going to write our mLs, our medication, our rate, and if we need to convert. And then we want to write over here what our answer needs to end in. All right, so let's fill out what we have. So we know that mLs, we have 500. Medication, we have 1 gram of lidocaine. The rate is 60 mLs per hour. And do we need to do any conversion? Yes, because they want our answers in milligrams and we currently have grams. So we need to go from grams to milligrams. All right, so first we're going to start with 1 gram is equal 500 mLs. So I know you're like, Nurse Doc, the last one you had it flipped. So remember, whatever measurement needs to go on the top, that's where you start first. So we would have to do 1 grams over mLs, because guess what? mLs is going to get canceled out. So we need to have the grams on the top. So when we convert it to mgs, that'll be on the top. All right. So we know that we're going to go ahead and convert to milligrams now. So we know that 1 gram is equal to 1,000 milligrams. All right, so grams cancel out. And then we're going to plug in our rate. So we have 60 mLs per hour. So mLs cancel out, mLs cancel out. So then we're left with mgs per hour. Our answer wants us to be in mgs per minute. So we know that 1 hour is equal to 60 minutes. So we're going to multiply straight across. And then we're going to divide straight across. Once we get those two numbers, we're then going to divide by, then we're going to divide. So we're going to get 60,000 divided by 30,000. And our answer is going to be 2 mgs per minute. All right. I just want to thank everyone for watching this video, and hopefully I made critical care dosage calculation easier for you.